who is at risk of developing addiction. So one of the first things that comes to mind is a genetic risk. So what that means is that a lot of times you will see individuals who will develop substance addictions will already have a family history of somebody who has battled with addiction in their previous generation. So because of a shared risk that is transmitted across generations, just like if somebody has diabetes or blood pressure, the risk of transmission of that is always there in the next generation. Similarly, there will frequently be somebody in the previous generation, be it in parents, uncles, aunts, grandparents, who might have also battled with a substance addiction. So one of the main risk factors or one of the main reasons why a person might get addicted to a particular substance is a family history. The next thing that comes to mind is peer pressure. So what I mean when I say that is that particularly in the younger ages in school and college times, because of peer pressure, where a lot of other people who you are with, your friend circles, people who are supposed to be cool in the college, who you see taking a particular substance, smoking cannabis, smoking cigarettes during the lunch break, during free times, and it becomes a kind of a pressure that my group is engaging in it. I'll have to do the same so that I continue to be a part of the group. So for substances of addictions, peer pressure can also be a very important reason. The third thing is the portrayal of substances in social media. I mean, we all know of something of this sort that has been happening since ages for things like gutka, alcohol, where it is portrayed as a very cool thing to do, where it is shown that stars, superstars are these kind of people who engage in it, and it's a very sophisticated kind of, or it is something which is a very fashionable kind of a stance to be doing it. I am sure we must have seen so many advertisements while watching IPL on TV as well, right? Every advertisement in between IPL would also frequently have coverage of substances of abuse as well, or even behavioral addictions such as gambling. So the idea is that when we see somebody who is of a very higher status, somebody who is a superhero, somebody who is a very well-known personality doing it, it's quite natural that the younger generation who becomes very attracted to these kind of things can also work towards the direction of seeking substance just to try out. Because if my favorite superstar or if my favorite sports person is promoting it, then I definitely have to give it a try. The next and probably one of the most common reasons why a person might turn towards substance abuse or behavioral addiction is because of underlying stress. So many of individuals who we come across who are battling with addictions have underlying depression, anxiety, or sleep related problems, difficulty in focusing, and many a times they turn towards alcohol or turn towards sleep related medications to manage their sleep problems or to calm themselves down. They might start smoking so that it helps in improving their focus, it helps in improving their concentration and energy levels in the daytime, and gradually with time, as the situation progresses, they might become addicted to it. A lot of people might have underlying attention deficit hyperactivity disorder or ADHD, because of which as well they might be prone towards seeking substances. So these will be the different kind of reasons why a person might engage in substance seeking behavior and addictions.